Welcome to the Parent Hub, your ultimate guide for navigating pregnancy, parenting, and everything in between. I'm Lily, and if you're an expectant parent dealing with those pesky aches or wondering how to give your baby the best shot at a smooth delivery, you're in the right place. In this quick 6-minute dive, we'll explore why posture is a game changer during pregnancy, spot some everyday pitfalls to steer clear of, and arm you with simple, effective strategies to stay aligned and comfortable. Plus, we'll touch on easy exercises to prep your body for birth. Let's jump in and make your pregnancy journey a little easier. Pregnancy brings a whirlwind of changes to your body. Your belly expands, your center of gravity shifts forward, and hormones like relaxin loosen up your joints and ligaments. This can lead to common complaints like lower back pain, which impacts around 50 to 80% of pregnant people, hip discomfort, or even nerve issues like sciatica. But maintaining strong posture isn't just about dodging pain. It plays a big role in helping your baby settle into the ideal spot for labor. The sweet spot? That's the occiput anterior position, where your baby's head is down, with their back curved toward your belly and their face pointing at your spine. This alignment makes it easier for them to navigate the birth canal, potentially shortening labor, cutting down on pain, and reducing the need for interventions like C-sections or assisted deliveries. Research from sources like the American College of Obstetrics and Gynecologists supports this, showing that babies in this position often lead to more straightforward births. How does posture factor in? It all boils down to creating space in your pelvis. Keeping things open and balanced gives your little one room to rotate and drop naturally, especially in the later stages. Tight or misaligned postures can squeeze that space, making it tougher for baby to get into position and increasing risks like a breech or posterior presentation, where their back is against yours, often linked to longer, more intense labors. By prioritizing alignment now, you're investing in less discomfort today and a potentially smoother tomorrow. That said, it's easy to slip into habits that throw off your posture, especially with fatigue or long days. Let's highlight 2 big ones to watch out for when sitting, since many of us spend hours in chairs. First up, hunching or slumping forward, like when you're lounging on the sofa or glued to your screen. This curves your spine unnaturally, tilts your pelvis backward, and compresses the pelvic area, limiting circulation and space for baby. It can worsen back strain and even contribute to round ligament pain as your bump grows. The second common slip, crossing your legs, it might feel relaxing, but it twists your hips, narrows the pelvis, and reduces blood flow to your lower body. Hello, swollen ankles. This uneven pressure can make it harder for baby to maneuver, plus it adds extra stress to your joints. Ready to turn things around? Here are 4 actionable tips to promote better sitting posture, keep your pelvis welcoming, and support your overall well-being. These are drawn from expert advice and can be game changers with consistent practice. Tip 1. Elevate your hips above your knees. This encourages a gentle forward tilt in your pelvis, opening up space and easing pressure on your spine. Grab a firm cushion, rolled blanket, or even a stability ball to sit on. It's great for subtle movements that build core strength, too. Try this at your workspace or during meals for instant relief. Tip 2. Anchor on your sit bones for a neutral pelvis. Instead of rolling back onto your tailbone, shift forward so you're balanced on those bony points at the base of your pelvis. A quick way to find it? Gently rock your hips back and forth a few times, then settle in the middle where your back feels naturally curved. You can even use your hands to adjust your seating position for better alignment. It might feel awkward at first, but it prevents that backward tilt. Tip 3. Support your lower back's natural arch. Use a small pillow or rolled towel behind your lumbar area to maintain that curve, especially in chairs without built-in support. And don't forget to move. Stand up every 20 to 30 minutes for a short walk or stretch to reset. This keeps blood flowing and avoids stiffness. Tip 4. Spread your legs hip width or wider. This stabilizes your base, reduces hip tension, and keeps the pelvis open. If crossing feels irresistible, do it at the ankles only or stretch them straight ahead to maintain balance without compression. While these focus on sitting, remember posture extends to standing and sleeping too. For standing, keep your weight even on both feet, shoulders relaxed, and do a subtle pelvic tuck to avoid swaying. When lying down, side sleep with a pillow between your knees for hip alignment. To amp up the benefits, especially in your third trimester, weave in some gentle movement. Activities like prenatal yoga, swimming, or daily walks strengthen supporting muscles, boost flexibility, and encourage baby to engage. Try pelvic tilts or brief forward-leaning poses. They're fantastic for opening the pelvis and aiding rotation. For more, head over to our tailored Pilates routine video right here on the Parent Hub. It's low-key, home-friendly, and focused on pelvic relaxation for birth prep. Wrapping up, nailing your posture during pregnancy is about empowering your body to handle changes with grace, easing those daily aches, and optimizing conditions for your baby's big entrance. Skip the slumps and crosses, embrace these tips, and mix in some movement. You'll notice the payoff in comfort and confidence. If this resonated, give it a thumbs up, subscribe to the Parent Hub for more real talk pregnancy and parenting insights, and hit the bell for updates. Share in the comments, what's one posture tweak you're trying today? I might shout it out next time. Thanks for tuning in, stay strong, and we'll see you soon.